everybody. Restoring a smile with dental implants can mean a great end result that lasts a lifetime, but the process itself can seem a little daunting at the beginning, requiring a lot of trust with your dental surgeon. Here to tell us about the options for dental implants is Dr. Tigran, who is from Smiling Heart Dentistry.
That's correct.
That's a wonderful name that makes us feel nice and warm about all of this. And we have choices. If people need to rebuild their smile, there are a number of choices, but there's also just a ton of planning that goes into this from your side. Can you tell us about that?
Definitely. There's more than just placing a titanium screw or ceramic screw, which I prefer. So there's extensive planning, which we will quickly show in a minute. So before that, I could quickly explain what an implant is. An implant is like a substitute for your root, and then on top of it, you restore it with a crown, a bridge, or a full mouth restoration.
I think we have a graphic that we'll show to kind of help people imagine this, but you are working both in terms of airway, final results, it's engineering, it's artistry, there's a lot. So when you go to make a model of what the teeth are and what they should look like, what is that process like?
It involves a great number of people, including our team, our wonderful lab, world-renowned lab, and a lot of education. We take into consideration your airways, your muscles, and to create a beautiful smile.
So what are we looking at right there?
So this is a picture of your airway. It shows how when the tongue is retracted, your airway becomes smaller. And so we take that into a serious consideration, because if we make a smile that is beautiful, but it disrupts your airway, you can end up with a sleep apnea.
Right, you could actually cause what causes snoring and apnea.
Exactly. Interesting.
I think we have some video as well about the planning. Here it is, and I love this because we're sort of seeing the 3D modeling and the architecture work that goes into this. Would you describe what's happening here?
Yes, we have state-of-the-art technologies to integrate the smile that we design with the implants that we plan to place in. So this is a picture of a surgical guide that is being made after we design where the implants are going to be placed. And that surgical guide basically is going to transfer the design into the patient's mouth so that you can almost, with closed eyes, place the implants in a correct and ideal location.
Interesting. Okay, so there are 3 types of restorations that we're going to talk about. A zirconia bridge, what is that?
So there are several different restorations that a person can have when they're getting a full mouth restoration. I guess most people don't know about it, but one of them is a zirconia, full monolithic zirconia. It's out of one block of zirconia. And the advantage of that is over time it doesn't stain. It's very hard material, so it doesn't break easily. And it doesn't wear out.
That sounds good. All of that sounds good. A hybrid bridge, what is that?
So a hybrid bridge is made of a titanium framework that is covered with basically denture teeth. And the advantage of that restoration is it's easy to repair if something chips, but the disadvantages are over time it can stain and it can wear out.
And the staining is a hassle, right? You want something that's sort of one and done if you possibly can.
Definitely.
So what about zirconia with individual crowns? What would be the circumstance that would require that?
So this is like the Cadillac of the restorations.
Okay.
It combines both advantages of the hybrid to easily repair and the advantages of zirconia, durability and the beauty. So this is a picture of the zirconia framework with individual crowns. And if a crown chips, you don't have to replace the entire bridge, but you can just replace a single tooth.
And good to go. Okay, people are asking about and talking about ceramic implants these days. What is that exactly?
So I've brought a couple of models. So this is a traditional implant with a titanium implant.
That screws into the bone, right?
Exactly. On top of it, we restored with a abutment and a crown or a bridge or a restoration. And this is a model of a ceramic implant.
Here, I'll hold this one so you can work with that one.
So as a biological dentist, I prefer to use ceramic implants. And the reasons are several. One is aesthetics. It looks better because if you have thin gums, the darkness sometimes can show through the gums.
Okay.
But more importantly, there are several, you can have allergic reactions to titanium, which is minimum, about 1 to 4%. However, if you do, the implant might either fail or you can have autoimmune diseases that you don't even know about.
We don't want that.
Yes, so there is no known allergies to ceramic, and it's the most biocompatible material currently available for dental implants.
Interesting. Does it last just as long as the titanium?
Yes, it does.
So there's no problem with that. Okay. So what do you think sets your clinic apart from others?
So our clinic is, from beginning, it was based not to just create beautiful smiles, which was one of the big reasons, but we really want to take care of each individual patient as a person. At the end, I guess I want to say that, implants can evolve from titanium to zirconia to better designs. But, the best design is what you already have. It's just your own teeth, and they don't change. So I hope people take good care of their teeth.
Right.
If you do, you have an accident, something happens, we can definitely try to restore it. So over time, we have put a lot of money and time into educating ourselves, 10 to 20 times more than is required. We invested in a lot of technologies, and we're blessed with such a great team that I cannot imagine being anywhere besides them.
Well, it definitely is important, that kindness to patients who feel vulnerable, and this is kind of intimidating, and if you have a good team, that makes a big difference. Thank you so much.
You're welcome.
Appreciate it. For questions or to schedule a visit to see Dr. Tigran, you can find more online at smilesfromheart.com. When we come back, how to know when a family member or friend might be struggling with an eating disorder and how we can most effectively help.